At the time they had malaria. Now China no longer has malaria. So why should they invest in more research for malaria products? So we have to be deliberate on this. And I pray that the deliberations and conclusions you come up with from here are implemented. Coming here to give speeches, making strong statements won't be enough if we don't implement. Cost them, engage with God parliaments, the ministers will bring them to parliaments, and we see how we support this very, very important aspect. I'm a very happy African today. Very, very, very happy African today to see that critical players from Africa are here. Not only to look at solutions, but you need to come up with a clear resolution that you are going to support African manufacturers. African manufacturers for pharmaceutical products. We must come from here with a resolution deliberate that they are going to be supported and introduced by the African government. Right, Honorable Emerson, we can't wait anymore. I kindly request you, sir, to come and address us.
Let us be seated, please. Thank you. Before I make my remarks, allow me to introduce the delegation that accompanied me to Kampala, Uganda. I am accompanied by Honorable Senator Tabitha Mutinda. Senator Mutinda is a member of the Standing Committee of the Senate in charge of health. I'm also accompanied by my Chief of Staff, Mr. Ben Fraha. Now, another thing I want to say is if you speak last, if you're the last speaker, you risk being repetitive. So should I, at any point, touch on an issue that has already been touched on, don't consider that repetitive. Consider that I'm reinforcing a very important matter. My dear brother, the Deputy Speaker of the National Assembly of Uganda, our dear host and Minister in charge of Health in the Republic of Uganda, and your colleagues present, dear participants, honorable delegates, ladies and gentlemen, good morning. It is a profound honor and a personal joy to stand before you here in Kampala, a city that has long stood as a pillar of culture and resilience in our region. I bring warm greetings and deep solidarity from my brothers and sisters in Kenya. Allow me to express our heartfelt appreciation to the government of Uganda and the people of Uganda for the compassion extended to Kenya during our recent moment of national mourning following the demise of the late Honorable Raila Amolo Odinga. The memorial service held here in Kampala reminded us that Kenya and Uganda do not merely share borders. We are heritage, kinship, and we share the same destiny. Ladies and gentlemen, we meet at a defining moment for the African continent. Africa continues to bear a disproportionate share of the global disease burden, like it has already been alluded to by our host minister. While too many holds still face catastrophic health expenditures that push families into poverty, access to essential health services remains uneven and often insufficient. These are not abstract data points. They represent real lives. Families delayed from care, communities underserved, and health systems stretched beyond capacity. The COVID-19 pandemic further exposed global inequalities, where supply constraints left Africa wanting, even as others secured surplus. The moment reminded us that health insecurity is not just a development issue, it is a sovereign issue. It also reaffirmed what the African Health Strategy 2016-2030 underscores, that health is a human right, and that the resilient systems must be built through intersectoral collaboration, linking education, innovation, environment, and social protection in one ecosystem of care and accountability. Yet Africa is not beginning from zero. Across the continent, bold innovations are already reshaping the health outcomes. In Kenya, for example, our pharmaceutical sector supplies approximately 1/3 of our domestic medicines demand, and we are intentionally advancing toward 60% local production by 2030. Additionally, over 100,000 community health promoters now deliver primary health care at household level, significantly strengthening universal health coverage. In Rwanda, the use of medical drone delivery has markedly reduced response times for emergency blood supply in remote areas, saving countless lives. In South Africa, the expansion of the vaccine manufacturing capacity marks a critical step towards reducing Africans' dependence on external vaccine supply chains. Here in Uganda, globally recognized models of HIV self-testing and community-based treatment access continue to bring dignity, accessibility, and innovation into public health systems. These advancements affirm one truth: when Africa leadership, investment, and innovation align, transformation follows. Across the continent, we are witnessing the spirit of Agenda 2063, the Africa we want. An Africa capable of defining its own priorities, financing its own health, and protecting its own people. Allow me at this point to share briefly Kenya's own journey towards universal health coverage, a story of reform, courage, and conviction. In 2023, Kenya enacted the Social Health Insurance Act, replacing the decade-long old National Hospital Insurance Fund with a new Social Health Authority SHA, an imagined institution designed to deliver true universal health protection for all Kenyans. Under this new structure, 3 national funds have been established: the Primary Health Care Fund for community-level services, the Social Health Insurance Fund for comprehensive coverage, and the Emergency Chronic Illness and Critical Illness Fund to cushion families from catastrophic medical costs. Together, they ensure that no household slips into poverty because of illness. Every Kenyan household today is now being registered under this new system, and the government directly subsidizes contributions for poor and vulnerable households. At the same time, over 100,000 community health promoters already deployed nationwide are linking families to care and ensuring that financing and service delivery meet at the doorstep. This model is more than a national reform. It is a practical demonstration of how African nations can build resilient health systems through local innovation, shared accountability, and inclusive financing. It shows that universal health coverage in Africa is achievable, not in theory, but in practice. This approach echoes the Africa Health Strategy call to expand social protection, address the social determinants of health, and invest in equity, ensuring that development and health progress move hand in hand. This is the vision embedded in Agenda 2063, an African capable of meeting the health needs of our people with dignity, confidence, and autonomy. It is also the vision of the African Health Strategy 2016-2030, a continent free from heavy burden of disease, guided by leadership, innovation, and people-centered governance. To achieve this vision, we must not only diagnose the challenges, but also prescribe the solutions, and most importantly, implement them at scale. First, we must mobilize sustainable domestic financing for health, including capital markets, sovereign funds, and structured public-private partnerships. Secondly, we must deepen investment in African research about technology and innovation, enabling African scientists to solve African challenges on African soil. Third, we must harmonize regulatory frameworks to allow medicines, vaccines, diagnostics, and health technologies developed in one African state to be distributed efficiently across the continent. The Africa Strategy calls this leadership and good governance in health, a commitment to evidence-based policies, regional collaboration, and accountable stewardship. Fourth, we must empower and equip our youth, not merely as workers in the health system, but as owners and architects of Africa's emerging health economy. Agenda 2063 reminds us that Africa transformation will be people-driven by its youth and women, and that every investment in human capital is an investment in the continent's sovereignty. A nation cannot innovate if its people are unwell. A strong economy cannot stand on a weak health foundation. Every time Africa imports medicines that could be manufactured here, we export jobs, capital, and strategic security. Let us therefore embrace the call in Agenda 2063 for inclusive, sustainable growth, one that creates shared prosperity and ensures that health is not a privilege of the few, but a guarantee for all Africans. Imagine an Africa where scientists drive global vaccine development, our pharmaceutical industries supply regional markets, and our youth find purpose and prosperity in building solutions at home rather than seeking opportunities abroad. This is not a distant dream. It is the policy choice that we can make today as we sit here. Let us commit today to do the following: operationalize continental framework on the health sovereignty to streamline regulation and guarantee equitable access to medical products. Launch and capitalize an African Science Research Fund to support homegrown innovation, and also ensure that by 2030, at least 1/3 of Africa's medical supplies are manufactured on African soil. And in doing so, let us align with the African Health Strategy goal to allocate at least 1% GDP to health research and innovation, fostering an African-driven response to public health challenges. In conclusion, let the message from Kampala be clear: that Africa is not waiting to be helped. Africa is ready to lead. As the proverb reminds us, when the roots are deep, there's no reason to fear the wind. Today, we deepen our roots as Africans in unity, innovation, and sovereignty. May our deliberations here mark a turning point toward the Africa envisioned in both the African Health Strategy 2016-2030 and the Agenda 2063, the Africa we want, an Africa that is healthy, united, and self-reliant. With these remarks, it is now my singular honor to declare the Africa Health Summit 2025 officially open. May God bless all of you. May God bless the Republic of Uganda, and may God bless our beloved continent of Africa. I thank you.
Ladies and gentlemen, a big round of applause for our chief guest. And I'll invite our chief guest to stay and invite all the ministers to join you for the group photo and invite the protocol teams to handle that. The Honorable Minister of Science would have said a vote of thanks, but our chief guest and the Deputy Speaker have another engagement that they must run to. And we request that when he returns, we'll allow for the Minister of Science to also address us. So the others will also join them. The Honorable Ministers, Your Excellencies, the Ambassadors, please do join them. And then I'll invite for the second category our scientists who will join them right at the back. And also invite from the private sector Dr. Cedric and Emmanuel Katongole. Emmanuel Katongole representing, of course, QSIL, but also the Presidential CEO Forum. We'll ask the others to join them at the back because we're using the entire tier of the stairs to represent all the key partners and stakeholders. We have the WHO regional representative. We have the Africa CDC team. We have our scientists from Botswana, the DRC, and Ghana. And we have, of course, the entire delegation from the Republic of Somalia, Ethiopia, Rwanda, Kenya, and of course Uganda, and the entire delegation represented by our Honorable Minister. And so we'll allow for photos, a few more pictures. Our chief guest. Thank you very much. We'll allow for our other guests to take their seats. Your Excellency, the Ambassadors, you may take your seats. The Honorable Ministers, we'll only allow for our Chief Guest and the Speaker. The rest of us will remain seated. As I invite Praise, Praise will be giving us a piece of entertainment before we dive into our very first agenda item, our very first conversation. And I will introduce that at an opportune time. I need to mention that the Honorable Ministers and our Ambassadors will be joining us again because they're just seeing off our Chief Guest and returning to the room. Shortly we'll have the keynote address, and may I invite Praise, who is going to entertain us shortly, to take to the stage and begin the process of allowing us transition to the next session, our very first panel, a panel of scientists that will be sharing with us the key innovations in the sector. So as I invite Praise, I want to welcome our delegates, and I want to welcome all our partners, and more specifically appreciate our sponsors for being part of this Africa Health Summit, the inaugural Africa Health Summit. So shortly we'll have Praise entertain us, and immediately after that we'll have our keynote address, and that will mark the opening session before we dive into our very first panel discussion. We want to appreciate all the sponsors and appreciate all the partners on behalf of the Ministry of Health and on behalf of our co-hosts, the Parliament of Uganda, all the key stakeholders who've joined us for this first Africa Health Summit. We want to appreciate all the partners that have initiated and supported this inaugural summit, and we at a later moment will be introducing the sponsors and thanking them. but also throughout the presentations, we will be highlighting the different innovations that some of our sponsors and partners have been championing here in Africa, here in Uganda, and we'll highlight those both in video and of course in the presentations that will be coming up. The private sector will have a session later this morning highlighting initiatives within the private sector to support the health sector. And then later, we'll also have the ministerial roundtable, a conversation of ministers who are our key stakeholders at the policy level, driving the various transformations across the health sector in Africa. So we want to appreciate those of you who are joining us online. We have a live stream that is available, the Africa Health Summit live stream. We welcome our virtual audience. We welcome our TV audiences that are joining us and are part of this very first Africa Health Summit. So I will invite Praise, who will now entertain us before we have our keynote. Over to you, Praise.
Good morning, everyone. Protocol observed. My name is Praise. Thank you.
There is a time when we should heed a certain cause, 'cause the world, it seems, is right in its line. 'Cause there's a chance we're taking in leading our own lives, it seems.
There comes a time when we hear a silent call, when the world must come together as one. There comes a time when we hear a silent call, when the world must come together as one. There are people dying. Oh, it's time to let on to life, the greatest gift of all. We can pretend, know a better day, that someone somewhere will soon make a change. We are all a part of God's great big family. And the truth, we know love is all we need. We are the world, we are the children, we are the ones who make a brighter day. So let's start giving. And there is a choice we make. We're sitting on our lives. It's you who make a brighter day. Just you and me. Oh, yeah, keep them your heart. They shouldn't be that sure that someone someday will soon make a change. day, so let's start giving. There is a choice we're making. We're serving our lives. It's you will make a better day, just you and me.
Ladies and gentlemen, big round of applause for Praise. That surely isn't enough. Can we give her another round of applause, ladies and gentlemen? What a voice. And there is no better intro to a keynote address than this you'll get anywhere in the world. So ladies and gentlemen, welcome with me Dr. Abdul Rahman Diallo, the Director Program Management at the WHO Regional Office for Africa. He will be making our keynote address on reclaiming Africa's health future from dependency to sovereignty through innovation and solidarity. Ladies and gentlemen, please give him a warm welcome as he makes his keynote address.
The Honorable Dr. Jane Acheng, Uganda's Minister of Health, members of the Parliament present, Honorable Ministers of Health and heads of delegations of other African countries present, the East Africa Regional Director for Africa CDC, valued development partners, private sector and civil society representatives, distinguished colleagues, members of the media, ladies and gentlemen, good morning. What a profound honor it is to join you here in Kampala, a city whose strength and resilience reflect the very essence of Africa. On behalf of Dr. Mohamed Yakub Janabi, WHO's Regional Director for Africa, I extend warm greetings and appreciation to the government of Uganda and our partners for hosting this historic inaugural Africa Health Summit. By bringing together ministers of health, African Union institutions, regional economic communities, researchers, and civil society leaders, Uganda has given Africa a home for dialogue, evidence, and action. This summit comes at a defining time when the world is looking to Africa not as a recipient of solutions, but as a source of them. Its theme captures what our continent needs most: stronger systems, empowered communities, and solutions that endure. To reclaim Africa's health future, we must move from dependency to sovereignty through innovation, solidarity, and shared responsibility. Africa is the world's youngest region. Over 60% of our people are under 25, and more than 400 million are aged between 15 and 35. They demand systems that work, leaders who listen, and institutions they can trust. Their expectations should inspire us and hold us accountable. We know the stakes. Millions of households still face catastrophic out-of-pocket costs when they seek care. Financing remains inadequate. Most countries spend less than 5% of GDP on health. Climate change and conflict continue to test our resilience, but we also see extraordinary solidarity, neighbors synchronizing vaccination campaigns across borders, frontline workers risking their lives to save others, and communities protecting one another. This summit is Africa's answer, a space to turn solidarity into strategy and dialogue into decisions that shape continental policy. Let us always remember, our systems are ultimately about people. Let me tell you about Aisha Nangobi,
a 29-year-old midwife and mother of two from this very country, Uganda. When Ebola struck earlier this year, Aisha lost her husband, the first confirmed case within days. She fell ill herself, recovered, and with psychosocial support from the Ministry of Health and WHO, found the courage to return to her clinic. Each day, she brings new life into the world, even as she carries the memory of her loss. Her story shows that resilience is not an institutional word. It is a human one. Behind every plan we design stand people like Aisha, whose courage turns policy into purpose and whose strength gives meaning to our systems. This is why, at the WHO Regional Office for Africa, our partnership with member states is guided by 4 pillars: universal health coverage, resilience, modernization, and ownership. Each pillar represents a promise to strengthen systems, empower communities, and advance sustainable solutions towards the Africa we want. The first pillar, universal health coverage, is the bedrock of resilient systems. To achieve that goal, we must both improve access to quality health services and address the significant financial hardship suffered by people seeking health care. Despite our collective efforts, the African region remains off track to achieve UHC by 2030. The WHO Afro Service Coverage Index currently stands at 46 out of 100, well below the global average of 68. An estimated half of all Africans still lack essential health services, and millions are pushed into poverty each year by out-of-pocket spending. Most countries allocate less than 5% of GDP to health, with the Abuja 15% target remaining largely unmet across the region. At the same time, development assistance for health has fallen significantly below 2021 and 2025, even as debt servicing costs climb across the continent. These realities underline why domestic investment in primary health care is the fastest and most equitable path to accelerate progress towards UHC, building resilient systems that protect every community in every corner of our continent. However, across our region, we see progress. Uganda's pharmacy-led primary care model brings services closer to communities, and Kenya's digital health financing platforms extend protection to millions. Rwanda's community-based insurance now reaches nearly every household. These examples prove that innovation and equity can work hand in hand. And they translate into lives like that of Alimata in Burkina Faso. When she first learned she was HIV positive, she thought her life was over. But thanks to continuous antiretroviral treatment and counseling, she is thriving, running her business and mentoring others. Her story is the definition of empowerment, how care saves lives and hope sustains them. In our region, more than 20 million people are receiving HIV treatment, a milestone of sustained systems and community engagement. To make such progress universal, we must invest in what underpins it. Electricity for every clinic, digital connectivity linking rural nurses to specialists, and fair pay for the workers who keep systems alive. Health spending is not charity. It is nation building. Every dollar invested returns many times in productivity and peace. The second pillar, resilience, is the bridge between crisis and continuity. The WHO African region responds to more than 100 public health emergencies every year, from Ebola to cholera to floods and droughts. But each crisis has strengthened our capacity, new laboratories, trained responders, and a continent that understands the value of cooperation. We are integrating climate adaptation into every plan, supporting solar-powered vaccine fridges for off-grid areas, fortifying health facilities against future floods and storms, and building early warning systems that protect both people and crops. Together with Africa's CDC, we are strengthening national public health institutes as a continental network of surveillance and rapid response, an early warning system rooted in solidarity. Resilience must also heal minds. Aisha's story reminds us that mental health and psychosocial support are vital to recovery. Preparedness is not only measured in stockpiles, but in the confidence of our people to stand and serve when threats strike. The third pillar, modernization, is how we transform resilience into sustainability. Africa is already a laboratory of ideas, mobile money health payments, drone deliveries, and AI-assisted diagnostics. Our scientists lead in genomic surveillance. Our researchers and programs have driven the trials and rollout of malaria vaccines, now expanding across the continent. The task ahead is to scale what works and share what we learn. Our work at WHO in the Africa region includes building regional technical hubs, digitizing processes, and bringing expertise closer to countries aligned with Agenda 2063 and the AU Health Strategy. Modernization also means investing in people. Community health workers are our quiet revolutionaries. With training, digital tools, and fair pay, they extend care to the last mile and rebuild trust in health systems. Transparency and accountability complete this pillar because credibility is the currency of public trust. The fourth pillar is ownership, our pathway from dependency to sovereignty. Around 80% of the WHO Africa region budget still comes from voluntary, often earmarked contributions. That must change if Africa is to set its own priorities. Governments must increase domestic investment and treat health as national security. Innovative instruments, debt for health swaps, climate health bonds, blended funds can help bridge the gap. We must also produce what we consume. The COVID-19 pandemic exposed our reliance on imports. But new vaccine and pharmaceutical plants in Dakar, Cairo, Nairobi, and Cape Town prove that self-reliance is possible. Every vial produced in Africa is a declaration of sovereignty. Health sovereignty is not isolationism. It is partnership on equal terms, Africa contributing data, science, and solutions to the world. This summit theme reminds us that our sovereignty will be secured in the solidarity of one Africa, one health. Innovation is the bridge between our vision and our reality. When families monitor blood pressure at home, when youth share verified information online, and when women demand safe childbirth and clean water, public health is already happening. Governments must create environments that foster literacy, trust, and access so that empowered citizens become the first line of defense. The private sector and civil society are vital allies, manufacturers localizing production, tech startups digitizing supply chains, and community organizations ensuring no one is left behind. Co-creation with these partners is the engine of sustainability. When we say empowering communities, we mean placing trust and resources where impact is greatest in the hands of our people. Africa's role in global health must reflect its population, its burden, and its brilliance. We are no longer content to be the case study. We will be the reference point. The WHO African region's eradication of indigenous wild poliovirus proved what solidarity can achieve. We contribute solutions to the world, from equitable vaccine delivery to climate health adaptation and digital innovation. Our voice in global forums must be united, evidence-driven, and confident. That is how representation becomes influence. Excellencies, colleagues, friends, let us see this summit conclude with actionable commitments. Let us affirm our promise to embed self-care and community empowerment into national strategies, strengthen research and innovation to inform policy, mobilize domestic financing for universal health coverage and health security and sovereignty, foster partnerships linking governments to private sector and civil society partners, and report annually on progress towards our common goals. Actionable commitments will turn today's dialogue into the deliverables of the decade. On behalf of the entire WHO Regional Office for Africa, I reaffirm our commitment to this shared vision of sovereignty, sustainable health systems designed, led, and owned by Africa. If we can transform a hospital, we can transform a continent. If we can save one life, we can inspire millions. Let us build systems that endure, communities that thrive, and solutions that last long into the future. Together, let us make the promise of health for all the defining achievement of our time, inspired by the courage and commitment of the health workers and community champions we celebrate here today. Thank you very much for your attention.
Ladies and gentlemen, may we appreciate our keynote speaker this morning. Thank you very much, Dr. Abdulrahman Diallo, for setting the stage at this very first Africa Health Summit. Shortly, we'll have our very first panel discussion, and that will focus on the work being done by our scientists. But before that, one of our key stakeholders and a strategic partner for the Ministry of Health and all the other players in this sector is our Gavi CEO. And may I invite you to take a look at the screen. We have an opening statement. She couldn't be here with us, but would like to run her opening statement. So ladies and gentlemen, on the screen, the Gavi CEO, Sania Nishta.
Honorable Ministers of Health, distinguished delegates, partners and friends, I'm honored to share this message of solidarity with the Africa Health Summit. I want to congratulate the government of Uganda, and I want to commend my sister and Her Excellency Minister Jane Ruth Acheng for her vision and leadership. This summit comes at a crucial time for the African continent and the world. Across Africa, we see a complex picture, rapid progress tempered by persistent and profound challenges. As you know, health systems are under strain from economic shocks, climate pressures, and a growing burden of disease. At Gavi, we believe that strong, sustainably financed health systems are the foundation of every success story in global health. Immunization can be the backbone of these resilient systems. That is why, as we move towards Gavi 6.0, our focus is on country ownership and long-term sustainability. Through our Gavi LEAP program of transformation, we have transformed the Secretariat to put countries first, and to do everything within our mandate to accelerate each country's journey to self-reliance in immunization. That is why we are strengthening our collaboration with governments to mobilize domestic resources. That is why we are broadening and deepening our partnerships to attract innovative financing and ensure that every dollar invested in health delivers lasting impact. And that is why we have launched the African Vaccine Manufacturing Accelerator, or AVMA as we call it, to support a sustainable African vaccine manufacturing ecosystem that will provide jobs and growth at the same time as strengthening regional and global health security. The Africa Health Summit is a call for sovereignty. It's a call for solidarity and innovation, and Gavi is answering that call. So to every participant in Kampala today, I urge you to keep pushing the boundaries of what is possible. Your leadership will determine not only Africa's health trajectory, but the world's collective health security. All of us at Gavi stand with you. Thank you, and my warmest wishes for a successful and inspiring Africa Health Summit.
Thank you very much. Ladies and gentlemen, our very first panel discussion. And I need to prepare you, because if you didn't do any science classes, you may have to Google some of the words they will be speaking. And this is when you wish you had stayed in your physics and chemistry class a bit longer. But more importantly, why did you drop biology? But why? So ladies and gentlemen, allow me invite our scientists who will be looking at operationalizing the new health order, the new public health order. They'll also be looking at scaling Africa's health manufacturing agenda and catalyzing innovation for health sovereignty. May I invite Uganda's very own Dr. Misaki to come. Dr. Misaki will introduce his panel. And please, scientists, we have an audience that never went to medical school. Please help us understand the heavy words that you will be sharing. And if you can, try and lay them out for the layman, like some of us who did social sciences, all right? So ladies and gentlemen, please welcome Dr. Misaki.
Thank you, Morris. Thank you, Morris. Good morning. My panelists kindly come up. Dr. Mazaba Lucy, the Regional Director for Africa CDC. Dr. Mosoka Fala, Dr. Babe will join us from online. I don't know whether Dr. Babe is on. The Africa CDC is Africa's autonomous continental public health body that was inaugurated in 2017 but the plans, I think, had been in place since 2016. And it's amazing that this coincided with the biggest outbreak of Ebola in West Africa. I welcome you today because we expect to hear from you to tell us how Africa CDC is operationalizing the new public health order. In 2023, following the challenges that we all experienced during the COVID-19 pandemic, Africa CDC passed this package, the new public health order. Lucy, could you briefly tell us what this is about and how Africa CDC is working to operationalize this?
Thank you. Thank you. Thank you very much. So when you're being introduced, I heard Misika, and I'm like, our very own. So now Japanese have become Ugandan. So I did a bit of training in virology and immunology in Japan, and that name sounds very Japanese.
Yes.
But interesting to be here with you, and thank you very much for the opportunity to allow the Africa CDC to have or be part of this conversation. I think you've rightfully said that we've had a lot of lessons learned on the African continent. And indeed, one of the reasons the Africa CDC's birth was escalated was because of the Ebola 2014 outbreak that hit West Africa. And I think the heads of states and government, guided by their ministers of health and other technical persons, recognized that there was need to have a sovereign body on the continent that would help secure the continent's health. And so the Africa CDC, after discussions and endorsement by heads of states and government, was actually established in 2017. And after that, just at birth, a few years later, shortly, COVID-19 hit. And we had some systems in place, still quite young, but also leveraging on the strengths of the member states, were able to manage the COVID-19 in a decent manner, securing, though late, a number of vaccines, improving diagnostic capacity in the member states, and so on and so forth. So looking at all these situations that have occurred and stressed the health of our people on the continent, we needed to relook at how we manage health security. And so the new public health order was born. And really, to just get to the point of what you are saying, one of the important things that was noted is that Africa has to become responsible for the health of its people. And how do we do that? We need an important capacitated workforce. We need financing. We need medical supplies and products. We need institutions that can manage this. And so you did hear from Dr. Diallo talk about how we're pushing the establishment of NPHIs or public health institutions on the continent, and that's one of the major pillars of the new public health order. But we're also looking at the conversation around local manufacturing, innovation, which Dr. Mosoka will also talk into, and ensuring that we have enough commodities on the continent. We're looking at financing, and I think the previous speakers in the keynote expressed, and the speaker also expressed, about domestic financing being a real game changer. So when you look at all these matters, this is what we're calling the new public health order, things that we've had conversations over a long time but need to be actioned. Thank you.
Okay, thank you, Dr. Lucy. I'll return to you, but let's go to Dr. Mosoka. Without undertaking R&D, Dr. Mosoka, whatever we are envisioning in terms of local manufacturing will simply be fill and finish. We will not have ownership of the IP. Could you tell us what you're doing, what you've been doing over the years to position the African continent, as well as, of course, set traction for African scientists to develop their own R&D agenda? How do you plan to finance this?
Thank you very much. I want to take a step behind. Financing is not the issue. Innovation and sovereignty is the theme. There can be no sovereignty when there is not economic power. And what drives economic power is innovation. I like to use this illustration whenever I speak to people to compare Africa, India, and China. Africa as a continent has 1.4 billion people. China has 1.4 billion people. India has 1.4 billion people. India is the second largest producer of pharmaceuticals, APIs. China is the second, India is the third. In 2023 alone, India reaped $50 billion from pharmaceutical industry. If you take the amount that India got from pharmaceutical industry, 50 billion, is equivalent to the GDP of over 10 African countries just from pharmaceutical. That is followed by China is number 2. Most of the formulation and API used in Latin America and the US comes from China. 1.4 billion, 1.4 billion. Let's look at Africa. 1.4 billion people with the same brains, but they are importing 99% of their vaccines. They are importing 95% of their drugs and diagnostics. So what is wrong with this picture? This is what we are trying to address, that the fundamental issues of R&D must be addressed if Africa will get to the point where we can produce innovations that will drive manufacturing. But there are 4 critical issues Africa must overcome. And these are the actions that we in the Science Directorate are trying to overcome. 1, Africans don't know what exists on the continent. Africans don't know what sort of infrastructure exists on the continent. There have been millions of dollars of investment from PEPFAR to do research. But an African scientist in Uganda may never know what exists in South Africa. So how are we addressing this as Africa CDC? This year we launched an ambitious project to map all of the research infrastructure in the 55 member states. As I speak to you, we've done 25 countries, and by December we'll be doing 40 countries. Next year we'll do the 15. Our findings has been very impressive. We have over 500 research institutions across different spectrum. What does that mean to what's going in R&D 10? We are going to launch 2 studies very soon. One is an injectable malaria vaccine. The second is a molecule developed by African scientists from University of Cape Town. We are going to launch 2 phase 1 trials in Africa by African. What did we do? We went to our database and queried our database and said, how many phase 1 trial sites exist on the continent? We found 34. Now what we are doing now is deep diving and say which one of the 34 sites is able to run a malaria trial. So for a long time, Africans didn't know what was happening. Number 2, African scientists operate in silos. They do not come together to work together. And so I went to school in the US and we ran major projects. You have 4 or 5 universities working on a major issue, but at different spectrum. Africans don't know what is happening on the continent. Now what we've tried to do is to bring scientists together on a major thematic areas. What have we achieved? Last week we had scientists from the DRC, South Africa, Tanzania, and Kenya to discuss a new antiviral molecule that was developed by scientists in the DRC. They have the molecule, but they cannot do the preclinical trial. But their colleagues in South Africa are able to do the in vitro trials. Their colleagues in Kenya can do the animal studies. Our colleagues in Tanzania and South Africa can do the nanotechnology. All of these exist on the continent, but people did not know. So Africa CDC role has been bring scientists together across the continent. The third weakness we have is that we have not had research architecture frameworks that will say, how do we do that? When I took over the Science Directorate, our first business was to develop all of the framework to govern research on the continent, including research prioritization, mapping. The last two frameworks we developed in Kigali a few months ago was to see how we can get ethical approval in 10 to 15 days if there is an outbreak. All of the pharma companies we speak with say ethical approval in Africa is a long process. We are trying to address that. The fourth problem we have is low human capacity. The senior scientists do not want to train the next generation of scientists. The environment does not exist. So what have we done? We've developed a big program to train physician scientists and pharmacy scientists. For 11 years, I worked for the NIH. Tony Fauci, the famous Tony Fauci, is not a scientist. He is an infectious disease doctor, but was trained at the NIH and he became a famous scientist. We developed that program, we wrote the curriculum, working now with countries so that we can identify pharmacists and doctors and train them as scientists. We started with a certificate program to a diploma, then we'll do the MD, PhD program. We need to build and accelerate it. Finally, low funding for R&D. But I can tell you the low funding for R&D is because of us, the scientists. One, we do research for publication and not for relevance. We don't see R&D as having commercial value. Why should politicians give us money every year when we're not helping them to deliver service so that people improve healthcare? Why should investors like Dangote give us money? So these are the 5 critical bottlenecks that we are trying to address by developing framework and reframing the way we talk science to our politicians and our investors to say, this is the return on investment if you invest in R&D. Thank you.
Thank you so much, Dr. Do we have a babe? Is he online? Has he joined? Dr. Mosoka, you leave us at a point where we have a shrinkage in the official development assistance that is going towards global health generally. And Lucy, could you tell us how these changes happening on the continent could demand that we probably reorient ourselves?
In Uganda because of leadership. And so we needed to switch in the mindset of our leadership to recognize that it's important to own the capacity to resolve your problems. I like giving an example of the African context. If you go into any African community and you're having a conversation about something important, a decision you need to make in that community. If you don't own even a chicken, you must sit at the gate. You cannot sit at the table to have that conversation. And so the restructuring, the ODA reduction is not just on the African continent. It's a global situation. And our colleagues in the global north are already realigning and saying, what is my priority? That is where I'll put most of my money on, and what I can spare, I can put elsewhere. And we need to get our member states to that stage where we recognize that health is not just about people being sick or not being sick. It has an impact on a lot of things, including our economy, our lives and livelihoods, and so on. And so we need to rethink and reimagine how we can manage financing on the continent. Dr. Mosoka said there's a lot of resources, and this is just not natural resources. There's even money, there's financial resources on the continent, but it's how we distribute it. So in countries where they've recognized that health is a key driver of the economy, of development, they are putting more money on that aspect. And we need to get our member states to get there.
Thank you, Dr. Masoka. You just launched the R&D framework. Could you please tell us a little bit about it?
So 12 years ago, I was a young graduate running after Ebola in West Africa, and there were a lot of parachuting of scientists. Scientists would come parachute into our country, take our samples and leave the country. There was a time a group took the sample at 4 a.m. There was no coordination, and so Africa did not gain. So essentially what we've done with the R&D framework, for the first time under MPOX, we've got a clear guidance how to coordinate research. If you cannot coordinate, you cannot track. If you cannot track, you cannot see your benefit. We've launched that, and that's going to be the modus operandi for almost all of our research. On the 27th and 28th, we are bringing together 40 scientists to look at arboviruses, the Rift Valley fever, the dengue fever, and chikungunya, and see from an African scientific perspective, from infectious disease modeling all the way to medical countermeasure, what solution exists. So essentially, the R&D framework is to coordinate, track, so that we do not lose resources.
Tell us about the composition. How is it framed?
Okay, the way we frame it, after our meeting last year in Addis Ababa, we had one thought. How do we group the African scientists by their expertise? So we took big diseases, the filoviruses, the Ebola and the Marburg. We created one group and brought all of the scientists together. We took the arboviruses, the dengue and the Rift Valley fever.
So how is this all going to be governed?
So they are already being governed. We have monthly meeting. We created a framework where the team in my department meet with the filovirus group, the medical countermeasure group. They meeting once a month. Even have the modeling group and the social behavior science group comprising of 10 member states. These people are going to meet in Addis and say, from the perspective of medical countermeasure, what do we have for Rift Valley fever? What kind of vaccine candidate we have? Like I said to you, we are closely working with our colleagues in South Africa that have had 2 molecules, one against chikungunya, one against Marburg. We are also trying to do nano-modification of ribavirin to be able to treat Rift Valley fever. We're going to come together by African and saying, what is our solution? That will be the composition of scientists across the discipline.
So tell us about the ministerial arrangements, the continental arrangements for overseeing R&D on the continent. That should probably be the last.
So basically, the way we solve R&D, that if we do not have the highest political level of support, we'll never be able to move R&D forward. So we created a framework by bringing together 132 scientists, ethicists together in Addis Ababa, and say, how do we want to govern research on the continent? At the highest level, we have a president to be the ambassador. The president will be the ambassador for R&D. What we foresee is that as a president, he can speak to his colleague for budget allocation, but we need stronger political will. Below the president are the ministerial advisor on R&D. This will comprise of Minister of Health, Minister of Science. These will be the ones that will be our major driver to advocate for result of R&D to lead to innovation and manufacturing. Below that, we have some of our senior scientists to lead the technical aspect of R&D. We say when we coordinate, we can track. When we track, we can optimize the benefit of R&D.
Thank you so much. Ladies and gentlemen, we would go on and on. I think this session was aimed to make sure that you appreciate that Africa CDC is offering us leadership. We are in the right hands. We should just position ourselves to follow the guidance that they have in place for us. Thank you, Lucy. Thank you, Dr. Fala.